Part 1. I'll be constructing a model of the elbow synovial joint. I'll need 2 paint stir sticks, 3 colors of modeling clay, 2 pipe cleaners, a hot glue gun, scissors, utility knife, a drill, 2 wood screws. I'm using my online exercise textbook, notes, and internet as resources for my diagrams. Also, I'm going to need toothpicks, paper, pen, staple gun, and a screwdriver. First, I'm going to take the 2 paint stir sticks. These are going to represent the arm bones, the humerus, radius, and ulna. I'll be cutting the 1 stir stick in half to create the ulna and radius. I'll draw a line on the stir stick 3/4 of the way, so then the thinner strip will become the ulna, and one will be thicker, one will be thinner. The ulna is thinner and longer, while the radius is thicker and shorter. I'll be cutting 1 inch off the thicker one to make it the radius. Using the purple modeling clay as the cartilage, I'm going to cover the distal end of the humerus. Following that, I'm going to connect the bones together with a wood screw.
Go.
Part 2. Now that my bones are attached with the screws here in the middle and the cartilage, my humerus, ulna, and radius are on this side. I'm going to be adding some green clay between the ulna and the radius as a connective tissue called the intercostal membrane. I'll also be adding the muscles with red clay. There are 7 major muscles present in the elbow, which flex, attend, and allow it to rotate in the forearm. The additional 9 muscles cross the elbow to act upon the wrist. These muscles can be grouped into flexor, extensor, and rotational groups. The flexor groups includes the bronchialis biceps, the bronchii, and the bronchiradius. These muscles bend the arm by decreasing the angle in the forearm and the upper arm. The extensor group includes the tricep bronchi and the anaconus. These muscles increase the angle between the forearm and the upper arm, and by straightening the arm until the old cranium locks into the old cranium fossa of the humerus at full extension. The rotation is accomplished by the pronator tres and the supinator. These muscles cross at the elbow, allowing the palm of your hand to face up and down. With so many muscles ordinating and crossing at the elbow, it's not surprising how many injuries there are with the elbow.
Okay.
Part 3. Just to recap here, the red is our muscles, the purple is the cartilage, the green is the connective tissue, and the wood sticks are our bones. Now we're going to add the tendons and the ligaments. Ligaments are bone to bone. There are 3 main ligaments in the elbow. There is the annular ligament, the radial collateral ligament, and the ulnar collateral ligament. The annular ligament is the elbow attached to the margin of the trochanterior notch of the ulna, and it encircles the head of the radius, functioning to keep the head in contact with the radial notch of the ulna. The radial collateral ligament is located in the joint capsule and on the side of the radius, and the ulnar collateral ligament is located in the medial wall of the joint capsule. It is made up of thick band of fibrous connective tissues. And then the 3 tendons, or there's just 2 tendons. They're muscle to bone. There are several tendons connected to the muscles and bones of the elbow, but the primary 2 are the bicep tendon and the tricep tendon. The bicep tendon attaches to the bicep on the front of the arm to the radius, enabling you to forcefully bend your elbow. The tricep tendon attaches to the tricep muscle of your ulna, enabling you to forcefully straighten your elbow. Part 4. I have attached these green pipe cleaners here as the tendons, and these purple pipe cleaners here are the ligaments. A really popular sports injury for the elbow is known as tennis elbow. This is a common term for a condition caused by the overuse of arm, forearm, and hand muscles, which results in an elbow pain. Tennis elbow is caused by either abrupt or subtle injury to the muscles and tendons around the outside of the elbow. Tennis elbow involves the area from the muscles and tendons of the forearm attached to the outside bony area of the elbow, known as the lateral epicondyle, right here.
Okay.
Part 5. With the shoulder in a neutral position, elbow flexion and extension occur in the sagittal plane and the horizontal axis.
Go.
So I made the elbow synovial joint. It is a hinge joint which allows flexion and extension along a single axis. The 3 bones are your humerus, which is your upper arm, your radius, and your ulna, your forearm. The muscles in your elbow joint is your pronator tres, your supinator, your anaconus, brachialis, your bicep bronchi, your tricep bronchi, and the tendons are your tricep tendon and your bicep tendon back there. And then there are 3 ligaments, your ulnar collateral ligament, your radial collateral ligament, and your annular ligament. And then there's your interosseous membrane, which is your connective tissue between bones.